You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. Today, we're also talking about sedation dentistry. According to my first guest, don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have Ohio's dentist, Dr. Thompson. Dr. Thompson, welcome to the program.
Thank you, Randy. I'm happy to be here.
Now, before we get into today's topic, and I have a lot of questions about the highly anxious patient, but for those that don't know you, who is a typical patient and what are the procedures that you do?
I would say we don't have a typical patient. We have patients, their age ranges maybe from 3 until up to 100.
Okay. People
it's
100
all over,
years old
it's
are
all
going
over
in
the
to
place.
see you? 100?
Occasionally my patients reach 100.
Okay.
We celebrate when they do.
All right.
And as far as the procedures we have a general dentistry practice, which means we do everything under one roof. We do implants, we do crowns, bridges, cosmetic dentistry. In fact, everything we do is cosmetic dentistry, from fillings to dentures, crowns, veneers. We give our patients great smiles.
All right. Now, you do IV sedation. One of the reasons why I invited you on the program, not a lot of dentists. I did some research. I guess less than 5%, 10%.
Sure. Absolutely.
Do sedation dentistry?
Sure.
What are the different categories? If you had to categorize the patients that are taking advantage of this sedation to get their dentistry done.
Well, first of all, you have the patient who's just mortally afraid of dentistry. I mean, we have.
Are there
patients,
a lot of those out there, really?
There are, 50% of the nation's population does not see a dentist on a regular basis. That's half the people out there are not getting regular dental care.
Okay.
So there's an incredible amount of people who are out there who are terrified of dentistry.
Like dental phobics. What do you call them, by the way, behind the scenes?
Well, dental phobics fits, just being afraid of the dentist. And those patients, they may have had a bad experience when they were young. I know I had a bad experience when I was very young. And it took me a long time to get over my fear of dentistry. So I identify very closely with those patients who have dental fears.
Okay, so the highly anxious, afraid of the dentist. Also, you say the busy person takes advantage of this.
Well, sure.
What do you mean by that?
Executive, probably the person who fits into that category the best is the executive. You've seen the executives that have all their age 40, 45, 50, and their teeth are all worn down. They have kind of flat, jagged teeth, and from the stress and from the wear. And those patients are very much candidates for cosmetic dentistry, veneers, crowns, rebuilding their mouths. And in the interest of time and comfort, many times they will opt for sedation dentistry.
I mean, it's much easier on them.
Much easier. Plus, we're able to do most of their treatment in 1 or 2 appointments.
So you just go. Now, is this true? I think we talked on the phone that people don't even remember sometimes the procedure.
They don't remember at all. It's an amnesic drug. We use Versad, which the patient has no recollection. After I start the IV, and it's simply starting an IV, a little plastic tube in the arm. We administer drugs, and it's very precise, very, very safe.
Now, you've had, let's talk a little bit about your background and training. You brought a lot of photos, by the way.
I brought a lot of photos.
I love these photos you brought. And so if anybody's watching, you got to stick around for that. But your sedation training, because you're saying it's very safe. Tell me a little bit about that.
There is special training with the IV sedation. There are 2 kinds of sedation. One is IV sedation, one is oral sedation. And they are really miles apart as far as both safety and effectiveness.
Okay.
I have IV sedation patients who take a minimal amount of drugs in order to feel comfortable to be sedated. There are other patients that they take a large amount of drugs in order to get them sedated. And with the IV sedation, I'm able to control that very precisely. With oral sedation, it's purely guesswork.
That's a pill.
That's a pill. And it's impossible to determine how much to give a patient just with a pill.
Now, is it true that IV sedation dentistry, and this is just an IV, that is safer than doing nothing? I heard, because the patient is more calm, possibly.
It's definitely
The heart is
safer.
calmer.
Hopefully, all dentistry is safe.
Okay.
But yes, it is a stressful situation for a lot of patients. And if the patient is relaxed, comfortable, their blood pressure is going to be lower, their pulse rate is going to be lower.
Okay.
So for a patient who may be somewhat medically compromised, the IV sedation is actually safer.
Okay, good. So there's a lot of people afraid of the dentist, and at the top of the show we said, don't let your fear of the dentist keep you from having the smile you've always wanted. Now you're a dentist, and you know, I told you this on the phone. You probably think that the smile is important. How important is the smile, in your opinion?
Randy, it's incredibly important. And over the years, I've been in practice for 33 years, and over the years, my appreciation of how important it is has just increased multiple times. But it's not just my opinion. In 2008, the American Dental Association did a study, and they determined that the smile is the most important physical attribute a person has.
Doesn't surprise me that the Dental Association would
Right.
say that. But I guess you're right.
No, sure. So I think it's natural to be skeptical that the American Dental Association would say the smile is the most important thing we have. But Muscle Fitness magazine did a survey for their readers, and the question that they asked was, what physical feature do you find most attractive in the opposite sex?
Okay.
And the number one response was the smile.
The smile.
Not eyes or hair or the body or toned muscles. It's the smile.
Now, you say that there's a lot of people, and you're from Columbus. Your office is where?
It's in Grandview Heights, Columbus, which is the closest suburb to downtown Columbus.
You say there's a lot of people that walk around, they're not smiling. They're being perceived as mad or unapproachable or whatever, and they just don't like their smile. Elaborate on that.
Well, people who don't like their smile don't smile.
Okay.
And the people that are proud of their smiles, they do smile. And it makes a huge difference. I mean, it's for me to change a person's smile so that they are happy with their smile, they can't stop smiling then.
Okay. You know, one of the things, and I asked you in the green room over there, I said, is there anything about what you do that you didn't anticipate? You said that you actually like it more than you anticipated. Because you wanted to be a dentist, by the way, when you were 6 years old.
Well,
is that right?
Well, that's right. I was saying that I wanted to be a dentist when I was 6 years old, when everybody else was saying
really
they wanted to
went
be
through your
firemen and policemen, and so it was maybe a little bit. I was joking a little bit, but you know, I like to work with my hands. I like to help people, and so dentistry, as I progressed through college, it was a natural fit for me, and I'm very happy. I mean, I love what I do. I love I love changing people's lives, and I do change people's lives.
Do you really change people's lives? Like what?
Absolutely, I do. Let's talk about the importance of the smile
a
little bit more. And Wednesday, I was in the office finishing up before I was going to go to the airport to come out here.
All right.
And I was trying to figure out, well, you know, how do I really stress the importance of a smile? And I thought, well, why don't I take some pictures of smiles and no smiles and see how that looks. So I'd like to show you some of my staff.
Okay, let's take a look at this.
I was walking around the office with this big camera telling my staff members, hey, we're having a smile contest. Smile for me. Yeah, and now don't smile. So this is a picture of Heather. Mm-hmm. And I had her smile before I had her not smile because I was doing a smile contest. But anyway, looking at the not smile, you can't really judge her emotions. But looking at the smile, I mean, a smile
makes a difference.
It makes a huge difference. I mean, to me, looking at her smile, she looks energetic. She looks youthful. She looks approachable. All right, let me show you another one.
Okay, this is creative. Very creative.
So this is Misty. All right, Misty has a great smile. We did a little Invisalign for Misty a couple of years ago. So her teeth are nice and straight. She has a beautiful smile. But the no smile picture, once again, try to read her emotions. Does she look friendly or approachable or happy?
Very nice. Good point.
And
there's people like this on a job interview that don't like to smile.
Well,
I mean,
who's going to get the job?
Yeah.
The one on the left or the one on the right?
That's the same person, but you're right. It does. It looks different. It looks different.
Absolutely. This is Amanda. Amanda's one of our dental assistants, and once again, the smile makes all the difference in the world. We have patients come in, and for a new patient appointment, we take x-rays. We also take photographs of the patient's smile. And sometimes it's really difficult to get the patient to smile because they hate how their teeth look. These are the people that were available at the time.
So this is
all of my staff have great smiles.
So not smiling and smiling. Yeah, looks totally different.
Yeah, yeah. So I've been doing dentistry for 33 years, and I've always had a emphasis on cosmetics.
Okay.
And when I started doing cosmetic dentistry, I thought, yeah, it's nice to make a person's smile look nice.
Yeah.
And what we started to notice was people that we improved their smiles for seemed to have life-changing events happening. They were getting married.
Like what?
They were getting married, they were getting pregnant, they were getting promotions. And in a smile, when a person who has a smile that they're not proud of goes around not smiling, and then suddenly they have a smile that they love, they don't stop smiling. And what that does to their life is incredible. It is life-changing.
Now, you're also a perfectionist. I heard from your practice administrator. Does that fit you? I mean, you want to make a beautiful smile. Yeah.
All right. I'd like to think that I'm not a perfectionist. There's a bad connotation to being a perfectionist. But in looking at patients' befores and afters, there's always something, very rarely do I have something or a patient's case where I don't see a little bit of something that I might have done a little bit differently.
Okay.
There may be a handful of cases that I have looked at and say, I wouldn't change a thing.
All right.
But I have a couple of those
Now,
with me. But it's one of those things that when we design a smile, then there's a lot that goes into a smile, and if there are certain factors that aren't perfect, then it looks way off.
But who notices these things, really? All these little nuances.
Well, the public notices that it's a beautiful smile.
And you can't put your finger on it.
But there's, you can't put your finger on it. But as a dentist, you have to be able to create the smile, and you have to know what does make the difference. Like the angulation of the teeth. If the teeth are off by 1 degree as far as angulation, people will notice.
Okay, good. Okay, good. Now we're talking about sedate. Go ahead.
But the midline, where the central incisors are, they can be off.
Midline is what? Right.
Midline is right between the two front teeth.
Okay.
Now that can be off even up to 5 millimeters, and people won't notice that. In fact, Tom Cruise, his midline was off 5 millimeters, and it didn't seem to affect his career. But if his teeth had been angled 1 degree, people would have noticed.
Because his teeth look different now.
Yeah,
so
they
do. Fixed that.
Yeah, so they've done some dentistry for him.
Okay. All right, good. Now, you brought some photos. Are these a mix? All these people had sedation?
Not all of the people had sedation.
Okay.
So there's some purely cosmetic cases, and I have some really exciting ones to show you.
Let's take a look. Let's take a look.
This is David. He's a 31-year-old healthcare worker, and he doesn't like his smile, and he's getting married in 3 months.
So let's look good in the pictures.
So he wants to look good in the pictures, and his wife wants his teeth to look nice. I mean, this is a really friendly, nice guy, but his smile is holding him back.
Okay, because it bothers him.
He doesn't smile like that. We make our patients smile like that.
Do you really? You have to make them smile?
So we have to make these patients smile because he doesn't do that in real life.
So when you see this guy smile, what do you see, and what were his options, and what did you do?
All right, so what I see is stained teeth. There are gaps because of missing teeth. He's missing 2 teeth on either side of those central incisors.
All right.
All right, so this is a very challenging case because if you just slap some veneers on there, those front teeth are going to look too big, and it's really hard to make those canine teeth look like lateral incisors. But we designed a smile, and it turned out beautifully for him.
Very
And
nice.
This was a very challenging case, and he ended
What
up.
does he say when it's done, by the way? Like when he looks in the mirror, what does he say?
These patients are ecstatic. They don't stop smiling. I mean, we didn't make him smile on this one.
All right. And what are those, veneers? What are they?
Those are veneers and crowns. Yes.
Okay. Mm-hmm. Is this one of those things? Because I mean, it definitely changes his appearance. And I'm not
It's
trying to
huge.
side with you here. You know, I mean, people need to know it's a real interview, and I'm not on your side here. I'm not
I
endorsing
understand,
you.
sure.
But I think anybody could notice, because you know, coming onto the show today, I'm thinking because you're telling me it can make such a big difference, but it really can.
Absolutely. Well, I'm going to wow you with some other cases too.
Okay, but this particular guy, when it's all done, now he looks good in his wedding photos.
Absolutely. Oh yeah, yeah. Notice in the before, Randy, that he really looks kind of like a kid. He's got gaps
Yeah.
between his teeth, and I mean, a nice looking guy. But in his after, then it's really apparent that he has
looks
a nice
well
smile.
put
He
together,
looks. Yes, he
polished.
does. Absolutely.
Okay.
Absolutely. Yeah. Well put.
So now what else do we have here?
All right. So this is a 61-year-old grandmother,
All right.
and
Looks pretty young here. Looks good.
she came to me and she said, "Doctor, I don't smile anymore. My grandkids told me that I have yellow teeth and none of them match." And so
They tell you
is
this
her.
on the consult? Is that right?
Oh, absolutely. She said, "I don't smile anymore."
Do they
I
usually have
used
a
to
reason
smile
for
and-
doing it?
Yeah, they're ashamed of their teeth.
Okay,
Her grandkids
okay.
noticed her teeth and told her she had bad teeth, so she doesn't smile anymore. So I look at her smile, and she has old crowns. You know, dental technology has changed dramatically in the last 20 years. Porcelains look just like tooth enamel. We're able to whiten teeth. We can do crowns in one appointment. We have veneers that look terrific. So I look at her mouth, and she wants all of her teeth to match.
Now,
she wants her
is
teeth
she
to look.
doing the sedation dentistry?
Oh, she's doing the sedation.
Because she was afraid of the dentist?
She found it unpleasant. She wasn't
Like
terrified.
everybody. Nobody likes a dentist, right?
Right. So she doesn't quite fit into the category of, you know,
phobic.
the phobic patient. She's had dentistry done before, and it's just unpleasant for her.
Okay.
She didn't want to be aware of it.
All right.
All right. So we did her treatment in 3 appointments, 3 sedation appointments.
What'd you do for her?
We did all new crowns for her.
Let's take a look at the after.
We did 26 crowns for her.
Let's take a look.
All right. Now, there's
Looks like
the
a
after.
different person.
Yeah, compare the two side by side. How much younger does she look?
Yeah, she does. Years younger.
And she, like other patients who don't like their smiles, she really wouldn't smile unless we really asked her to before. Now she doesn't stop smiling.
And it looks natural too. You know, going into this, I always feel like I could spot veneers walking down the street. I could spot them.
Yeah,
I'm a connoisseur of
bad
it.
veneers, sure. Yeah.
So,
our
so the
goal,
big bulky veneers you're saying is in the hands of the dentist, their artistry?
for
their-
the most part, yes.
Okay.
I mean, it does take expertise and design and foresight, be able to do a case like this. That her case is one of those that I don't see anything that I would change.
No, very nice. Now, what does she say when that's all done? Because that is pretty nice.
All right, she had a number of things to say. She was just in my office on Wednesday, and the first thing she said, well, you know, all of my friends, they've kind of gotten used to my new teeth, my new smile,
Okay.
but they keep complimenting me. They ask, have you changed your hair? You look terrific today. And she said, I haven't changed a thing, it's my teeth. And she loves her smile.
So
She
do they
loves her
come in? I
smile.
mean, do they come in kind of smiling more? And
When she walked into my office on Wednesday, that's how she looked for the moment she hit the front door until she left. She loves her smile.
good.
Yeah.
Good.
Now, the second thing she said was, you know, I've never spent this much money on myself before, and I'm so happy with the results. I'd do it again in a heartbeat.
Do most of these people wish they would have done it a lot earlier?
I know she does.
Okay.
Yeah, I know she does.
All right. Now, how much say so? Okay, so we're talking about sedation dentistry. Don't let your fear of the dentist or the excuse, as you say, that I just don't have the time, because you could do multiple procedures with sedation in one sitting, or the people that are phobic have no memory of the procedure. You say it's very safe. It's become mainstream.
Now, the third thing that she said to me was she had a medical procedure done recently, and she said, well, when I came out of there, I had bruises and it was swollen in my arm, and I went back in there and told medical people that my dentist does this a whole lot better than you guys do, and you do it every day.
Okay. So you're good at giving the injection.
Sometimes I say it's better to be lucky than good, and I'm lucky a lot on that.
So you're considered pretty good?
She thinks I'm pretty good.
Okay,
Yeah.
good. What else are we looking at? I know you
right.
know, for the sake of time, we'll go through a few more of these.
Okay, this is a pretty dramatic before and after. Hers is, this is really incredible.
Okay.
And this is someone that, if you look at her before picture, it looks like has to absolutely try to smile.
So she hated her smile?
It looks like a grimace.
Like she didn't like it?
She didn't like it. No, she never smiled. She works in the food service industry, and she would never smile.
But you say there's a lot of people. There's a lot of people around that really don't like their smile.
Absolutely.
And they just put it off and put it off and put it off.
Well, they hide their smile. There are those people that they smile with their mouth closed.
So when you see this woman, do you see the end result? Like,
I
does
do.
your mind work where you go, boy,
Absolutely,
this is going to be good?
sure. I'm looking at her smile, and I'm automatically starting to calculate, okay, how wide can we make the central incisors? How do we do the lateral incisors? How do we
That's
replace
the two front teeth, right?
The two front teeth, next to the two front teeth.
Okay.
How do we replace the missing teeth? Yeah, I'm doing that the moment I'm looking.
So what
at
did you
her
do
mouth.
for her?
So we did crowns and bridges for her. She had two missing teeth, and here, let me show you the after.
Wow.
She looks like a different person.
No doubt about it. Beautiful.
And once again, she couldn't stop smiling with those.
Well, I'd say so.
In fact, she was crying when we did her temporaries because it was such a dramatic change. Her temporaries looked almost as good as that, and she started crying because she was so happy with the experience.
In this economy, what's your case for why somebody should take care of their smile?
Well, your smile, invest in yourself, and it's an investment for a lifetime. The person's smile, just looking at the befores and afters, they're like different people.
They are perceived differently. I mean, if this woman was walking down the street, it doesn't look like the same person.
Right. And
Good.
say in a job interview, she's going to get the job, whereas maybe she won't.
Yeah, I mean, two people on a job, if one's smiling and one isn't, obviously, and with all things being equal, you hire the person that looks happy.
Absolutely, sure. A smile says it all. It's confidence, it's health, it's youth, it's all of those things.
What's the process like? And we are almost out of time. Somebody goes into your office. How do they know what it's going to look like? Like, what do you do?
We do computer cosmetic imaging for our patients.
Okay.
We take a before picture, and I actually gave her a picture of her afterwards before we did anything.
What does she say? I want that?
Absolutely.
So all of these photos are on your website?
Yes.
Right? Okay,
yes.
and we're out of time.
Okay.
But
do we have time just for a couple more?
Okay, two more.
Two more. Okay.
If you go quickly.
All right, so here we go. This is a young nurse. She came to me. She did not like her smile.
All right.
All right, so there's the after.
Oh my goodness. That's a very pretty smile.
She is a beautiful girl.
And there's a lot of people.
Beautiful girl.
Which is how, because at the top of the show, and I will tell you now, I feel like I know you a little bit more after interviewing you now for the last 28 minutes.
Yeah.
That, when you say small improvements can make a big difference in the smile, this is a perfect example of that.
Sure, absolutely.
In fact, completely different look.
In fact, those are veneers on those teeth. We could have done something similar, but not quite as dramatic, with some bonding. We could have de-emphasized the pointiness of the canine teeth and made the lateral incisors larger. But that's really a beautiful smile with the veneers.
And this one, last one.
Oh, this one is was just a wonderful case for me. This young lady came to me. We did Invisalign.
Very nice.
We did crowns. We did implants. She had missing teeth from youth. And when we were all done, I looked at her and I said, you know, you are incredible, beautiful, and thank you for letting me give you.
She's got to
your
be happy
smile."
with that.
Oh, she's thrilled.
Okay, good. Well, you know, we are out of time. So at the top of the show as a recap. Okay, so big on sedation dentistry. Don't let your fear of the dentist keep you from having the smile you've always wanted. If you want to, if you're busy, type A personality, sedation is great because they could get everything done.
Absolutely, sure.
One visit, couple of visits. Final message, somebody watching this, they don't like their smile. What do you say to them? And they're still afraid of the dentist, or they don't have the time, but they don't like their smile.
Yeah, don't let being afraid of the dentist keep you from getting the smile of your dreams. It'll make a huge difference.
You do all
in
your own
life.
consults, so they get to meet you?
They get to meet me, sure.
Free
Yes.
consultation by any chance?
We do free consultations, yes.
Well, good for you. I want to thank you for coming to the show. Great info.
Thank you, Randy.
Good for you. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com. Put in Dr. Thompson. You'll find him there. Also, for you Twitter people, if you want to comment about what you saw here about Dr. Thompson, it's hashtag The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.